Morning, everybody. Welcome to what feels like summer, and as Teresa said a minute ago, and to return to winter tomorrow night, I think. We're variety weather in North Carolina. So hope everybody survived by getting colds or too bad of allergy problems here. But thanks for joining us. Busy time of the year, a lot going on, a lot of conferences and things are happening, and just glad you made time for us today. Catherine, I'm going to turn it over to you with the Division of Services for Deaf and Hard of Hearing just to explain our CART services and sign language.
Sure. Good morning, everyone. This is Catherine. Um, just wanted to let you all know we'll have American Sign Language interpreters and communication access real-time translation, CART, captioning. If you would like to access that CART captioning through a Zoom screen, what you can do is on the bottom tab, there is a more with three dots. When you click on that, there will be a pull-up section that will show captions. If you click on that, you will be able to have captions on your Zoom screen. If you would like to view CART captioning in a separate browser or a different device, there is a link that I'm going to send in the chat in just a minute. This link will allow you to change the font size and color for visual accessibility as well. And the link will also allow you to enter your email address where you will get emailed a transcript following the meeting. ASL users can click on the three dots next to the interpreter's name and select Pin to view the interpreter larger. And later when we have a presenter with a PowerPoint on the screen, you can select side-by-side gallery view at the top right of your screen and pin the interpreter again, and kind of drag and increase the size however you needed. This is not just for ASL users, but anyone to do that side-by-side view. Um, yeah, and if you need anything else regarding communication access, feel free to let me know. Here's the cart link, and thanks so much, Mary.
You're welcome. Thank you, Catherine. Appreciate that. And also, just so you guys know, following the meeting, Sandra will post the recording of the meeting as well as all the slide decks and things for the meeting also. So let's see, get us going here. You were sent the minutes of our meeting in February. They were sent with the meeting reminder that went out on Monday. And I think we have a financial report from our Secretary Treasurer, Lee Little. Lee, turn it over to you.
Yes, good after. Oh, well, good
It
morning,
is Friday.
everyone. Yeah, it's definitely Friday and trying to get my bearings. But here's a quick Treasury update with the coalition. Since January 1st, we had about 32 individual memberships and 37 organizational membership. Our goal for 2026 are 100 individuals and 90 organizations. So we're off to a solid start for this year. Year-to-date income is slightly above budget, which is very good. Year-to-date expenses are slightly below budget, as we'll continue to monitor those things. If not that, any questions, that will be all for my report.
Okay. Any questions for Lee? Yeah, we are plugging along and with just routine expenses and things now. But thank you, Lee, for doing that. Appreciate all you're doing for the coalition. Um, let's see, moving along, what we've changed up the agenda just a little bit today, just to accommodate our speakers. We are going to move ahead with our key presentation for today. And as we move into the legislative session, we want to make sure that folks have a lot of background about things that might come up. Now, we don't know if anything particular is going to come up regarding assisted living in North Carolina, but there's typically things during the legislative sessions, most legislative sessions, that do come up. So today we're very honored to have two of our coalition members. We've got Frances Messer, who's president and CEO of the North Carolina Assisted Living Association, and Stacy Massey, who is fairly new in her job since the first of the year as the chief executive officer for the North Carolina Senior Living Association. And they're going to basically talk about assisted living in North Carolina and the role it plays in continuum of care and kind of some issues that and opportunities and challenges and things that they have as associations and representing their members in North Carolina. So I believe, Stacy, you're going to go first. So we'll turn it over to you and let you get us started. So thank you very much for being here, and welcome again to the coalition. And I bet by this time you've gotten your feet really wet in your new job. Even though she worked for the association before, she was got the new job as chief executive officer, so she knew what she was getting into.
Yes. Good morning. Thank you.
Oops.
Rose.
Isn't technology wonderful?
Yeah. Stacey, I don't know if on your end, or can you hear us?
I don't know who Murphy was, but I do not like his laws.
Exactly. Looks like she went out and probably will try to come back in. Let's give her 30 seconds to if that's the worst thing that happens to us today, we're okay, you know. That's okay.
Absolutely.
So Sandra, you've got the slide deck though ready to pull up, right?
Yes.
Okay.
And
I don't. Sorry about that. I don't know what happened. It just wonderful technology. Zooms are great until times like this, right?
Exactly.
Well, we got you loud and clear right now then. Thanks for being back.
Okay.
Stacy, you can
Thank
share.
you.
You can share your screen if you want to
Okay.
control your slides. It should be set up
Okay.
for you to do that.
Okay, let me pull that up. Give me 1 second.
Well, Sandra can also do it for you if it's easier for you. Whatever's
Yeah, Sandra, if you would like to do that for time's sake,
Okay.
I'll let you, if you don't mind. I seem to be
can-
glitching on my end for some reason.
I can do that.
Again, we appreciate y'all asking us to be here today. And as Mary said, I'm new to this role, but not new to the industry. I've worked as a provider, and I've been a part of NCSLA's for 20 plus years as a board member, and then the last 2 years as education director. I am a licensed nursing home administrator and a certified adult care home administrator. And actually, Francis and I worked together many moons ago. We worked for the same corporation when Francis was also working in the provider field. So I'm glad to have Francis here with me today. And we may tag team on this. So Francis, you feel free to chime in as well. We share so many similarities with Nicala.
Uh-oh.
And so we'll move on to the second slide. And I just wanted to share with you a little bit of information about NC Senior Living. And I'm not seeing the second slide. So
Oops.
I don't know if it's on my end or.
Can everybody else see the slides?
Okay, I see it now. It's
Okay.
there. Sorry.
Do I need?
Stacey, you froze and we missed your explanation about the association. Sorry.
Okay. Can
You know,
can
you
you
might
hear
want
me
to go
now?
off. You've evidently got a pretty unstable thing. You might want to go off, picture and just talk and then see if
Now I
that
can see it. Okay, yeah. Let me take my video off and see if that'll help. Hold on. Is that better?
Yeah, we can hear you. So just go ahead and try that. Let's see how that works.
Okay. All right. So what I was saying is we share a lot of the same similarities as Nicala, and we're very thankful to be partners with them, not just competitors in this industry. So at NC Senior Living, our mission basically is to provide leadership and assistance to our members as we work toward, relevant issues and challenges within the assisted living industry. One of the things that we strive the most for is to promote professionalism and high standards of care for our residents. That is our goal. I'm very passionate about education. I think it's very important for providers to understand the responsibilities of what they have taken on to provide care to our aging population and our industry. And so we really push that with our members, the importance of staying abreast of what the requirements are, and just providing high standard of care. We partner with a lot of agencies like the Coalition and other individuals who share interest in the care of aging and disabled. And we work collaboratively with public and private state agencies to ensure that quality of life of residents in assisted living homes is preserved. So you can move forward. We do a lot of advocacy. We do have a lobbyist. We share a lobbyist with Nicala, Jim Harrell, who is at the General Assembly advocating for not just our industry, but the rights of the residents to ensure that our regulations are fair for both the provider and the resident that we are serving. We have tons of experience within our association. We were founded in 1962, and we still have some of our founding members that sit on our board. Our new president actually is a third generation provider, Ed Weeks. Not only did Jeff retire, but our president, Dean Wilson, also retired. And so I stepped in a new role as well as our president, Ed Weeks, and he has tons of experience as well. And we do pride ourselves on our education. We provide in-service administrator and training programs, just as Nicala does. We also partner with UNCG to provide an online program for those that aren't able to attend in class. And a lot of students in the Master's in Gerontology and Social Work program participate and get their administrator's certificate in adult care home through that program. We sponsor 2 conferences a year. We have a spring conference, and then we also offer an annual fall conference. We allow ombudsmen to attend our conference for free of charge, as well as adult care home specialists and then other regulatory agencies. And then we offer webinars throughout the year for members and non-members. You can go on our website and join our webinars as well. That just talks a little bit more about our UNCG program for the students that we offer there. So you can move forward with that. So what are adult care home providers? So in 2003, and this is the most current data that I currently have, we provided care to 23,442 residents, and 9,000 of those had a dementia diagnosis. 1/3 of those residents' care were paid for by state and county special assistance, which we'll talk about in just a little bit further, and Medicaid. Another entity of adult care home is family care homes. Family care homes provide care to 6 or less residents, so they're licensed at a smaller capacity. I personally love the family care homes. It's a very intimate, personal care. It's just like a home. I actually operated family care homes, grew up in that industry since 1992. My children grew up with a geriatric population. My youngest sister learned how to read when she was 4 years old by a teacher who was a resident that lived in our home. So it's a dynamic and unique setup. And that serves in 2023, 2,357 residents, and 700 of those had dementia diagnosis. And more than half of those residents were paid for by our state and county special assistance program. You can move forward. This just talks about some data with the adult care homes, 1,083 licensed assisted living facilities in North Carolina. And those are 7 beds and up. They have an average size of 60 licensed beds, and there are 600 ACHs in North Carolina. Family care homes, if you can scroll that screen down just a little bit, I'm cut off there. There we go. Are licensed for 2 to 6, as we said, and they're more in residential neighborhoods and actually homes, like just a home you would live in. It does not look institutional at all. They're just set up, just as I said, like mine or your home. So who do we provide care for? We provide care for a very frail elderly population. And some of those needs are met by in-home care. So we work collaboratively with home care agencies or home health agencies to come in and provide any skilled service that they might need that's not on a 24-hour basis. Oftentimes you see that with physical therapy and speech therapy. We will contract, or the resident actually contracts with whichever provider they prefer to come into the assisted living to provide them that care that the facility is not licensed to provide. You may move forward. So before assisted living, many of the residents were served by a service called intermediate care within nursing facilities. And what that entailed and what we do today is we're able to monitor healthcare conditions like diabetes, hypertension, congestive heart failure. Very few, if any, adult care homes have a full-time registered nurse on staff. We are not required by licensure to do that. Some do. Some do not, and thus the need that we partner with those home health agencies. We primarily monitor and follow orders that are written and given to us by a licensed provider, such as a medical doctor or a nurse practitioner. And then we have trained medication aides that are able to administer the medication assistance that's needed by that resident if they so have it. We provide special assistance with bathing, dressing, grooming, eating, and ambulation. And we provide a lot of supervision, especially for residents with memory care that reside in licensed special care units. We provide transportation to and from medical appointments, even outings such as going to the movies, shopping, different things of that nature as well. 3 nutritious meals a day are provided along with snacks that the resident would prefer to have. And then we provide activity programs. I was in a community yesterday and a new resident had moved in and she was so proud. Her bridge club was coming to play bridge with her today, actually. And the facility was providing her refreshments for her little bridge club. And so she was just really excited about that and very proud of her home. You can move forward. So how are we funded? In North Carolina, to live in an assisted living facility, you're either going to pay privately. Some assisted living communities will accept long-term care insurance policies, so long as the policy has been written that it will pay for assisted living. The other avenue for payment is a funding program called State and County Special Assistance for homes that receive public money. That home has to be a provider of North Carolina Medicaid in order for that resident to live there if they are eligible for state and county special assistance. So what does SA pay and how much? State and county special assistance programs primarily pay for room and board, and we'll talk about what the other services are on a different page. This is where we run into a challenge. The SA eligibility rate is very low. That rate had not increased in over 15 years until about 3 years ago, when we were able to get passed through legislative law a COLA increase. So now, if each January when the Social Security increases, the eligibility rate increases by that percentage. However, it did not go back and capture 15 years of incomes that were not looked at. So last year alone, in a community that I am connected with, we turned away over 30 residents that would have been eligible to live within that community and who needed placement because families just were not able to provide 24-hour care for them. But because they did not meet the income threshold, and you can see here on the screen, for assisted living, if you make over $1,467 a month, you are not going to receive any state and county special assistance funding. And we see a lot of folks who are right there at that threshold, and the memory care is only $1,862. If you make over that, if you're at $1,900 a month, you are not going to receive state and special assistance program funding. And that's very detrimental to the population that we serve. I can share many sad stories with you. One that stands out the most to me, I received a phone call from a lady who was in her 40s. She and her husband were caring for her father-in-law. They had 2 small children. He had frontal lobe dementia. He required 24 hours of care. Physically, he was fine. He was not eligible to move into a skilled nursing facility, and he was over the threshold for special assistance, yet he did not make enough money to pay privately. This particular lady was in tears to me, and her last words to me were, "I don't know what we're going to do other than I'm going to end up divorced." And so those are the challenges that we face, or our members face, is trying to help people that there simply is no funding for because of this threshold that is there for the eligibility rate. So that is one of our biggest advocates. The biggest things that we advocate for is trying to draw attention to the need for that program to be looked at very carefully. You can move forward. So again, these are the issues that we face with the SA. If the individual is not eligible and they still need care in a residential setting, if they meet the qualifications and the physician agrees that they can go to skilled nursing does not have an income limit for their Medicaid program. With skilled nursing, if you have less than $2,000 in assets, you become eligible for Medicaid to assist in that. So we see a lot of folks that end up in a higher level of care that really could be at an assisted living level, but because of income restraints, they end up going to a level that they do not need, which really affects that continuum of care that we all advocate for the person to get the services in the area that they truly need. So we really need for those SA rates to be looked at and to be increased in the state of North Carolina. You can move forward. This talks about just, you can see that each year, every 2 years, adult care homes have to send in what's called a cost report. And we do not have the 24-25 data yet. We will have to look at the 22-23 data. And you can see here from this data, even based on the controller's office for a special care unit, our rates were $1,780 a month. And the controller's office showed that those rates should be paid out at $2,067 a month. And so that rate has not been adequately rebased to reflect the cost of providing room and board to seniors and persons with disabilities for over 15 years, which falls in line again with the eligibility requirement also. So you can see that's a huge gap there that has not been looked at. You can move forward.
Stacey, can I interrupt you just a minute? This is Mary.
Yes, ma'am.
So because of that gap, we're seeing a lot of facilities declining or deciding no longer to take state county special assistants. Is that correct?
That is absolutely correct. And we're also seeing some of the smaller providers close their doors. We have one family care home. I live in Montgomery County, and we have one family care home that my mother actually opened in 1992. And we had 3. We sold 2 of those 3 years ago, and we leased out another one. And the gentleman is closing it this year simply because of funding. And he serves a Medicaid population. And in Montgomery County, it's very rural, and you just do not see the private pays like you would in, say, Wake County. So smaller providers are closing their doors, and people are now having to move out of county, and families are driving 30 minutes to an hour to visit their loved ones because of this funding issue.
So just
Good
to pick up on
question.
that, and I don't want to, waylay your presentation or anything, but an issue that we certainly see is that we certainly want a continuum of care in all communities to the extent we can get one. So what is happening as facilities are closing because the state county special assistance rate is not enough for low income people to, for people to qualify, and then if they do qualify, for facilities to break even if they accept folks. So what we kind of basically are doing is cutting out a level of care for low income people that either don't have access to it or just barely over the income eligibility level and don't qualify. Is that correct?
Absolutely, 100% correct. One thing, and I'll kind of interject, and I didn't put a lot in the slides about this because it's still kind of out there in the works, but we did make some progress last year with House Bill 546, which is a program that the department is looking at to make eligibility for Medicaid. Special assistance is different than Medicaid. So special assistance pays for room and board and the other things that you see that I have listed here. But the actual care of the resident is paid by what's called a personal care service program, which does the bathing, the dressing, all of the person's activities of daily living. That program is funded by Medicaid, but the same eligibility requirements are there with the special assistance eligibility as it would be for Medicaid within an adult care home. The department has been looking at increasing eligibility for adult care homes for PCS programs only. And that is currently at the CMS level. Jeff and I were sitting on, I still sit on a stakeholders meeting with the department and trying to get this program under the correct distinction under Medicaid, and that is going to require CMS's approval. Once CMS approves, it'll come back to the department, and further work will be done on hopefully pushing this program through so that folks, they won't get special assistance, but their income is going to be over the limit anyway, which is going to cover their room and board. But the provider would be able to bill Medicaid for personal care services, which would make up that gap of difference that currently they are not able to do. I hope that makes sense. It's a little bit confusing, but that's something you probably want to keep an eye on if this interests you and see where that's moving along at.
We basically have multiple funded sources that are going into it.
Yes, ma'am. That is correct. This chart here just shows you what SA provides in it, and I just kind of went over that. It basically provides, it covers those administrative costs, it covers the operations and maintenance of the facility, the housekeeping and laundry services, your dietary services, property ownership, and recreation and activity supplies as a provider. These are the things where that money is distinguished out to. You can move forward. I don't want to take up all Francis's time here. And this is something, and Francis, you can chime in, that Nicala and NC Senior Living worked on. And honestly, we've worked on all the other things together as well. But there was a pilot program established, and you guys, I know Jeff has spoken on this before, and it was an accreditation pilot program. And Nicala and NC Senior Living were great advocates in this. And we are now working with DHSR to move forward with this program because the pilot program is over, and that program has shown that facilities who are accredited provide a higher level of care or higher quality of care. So we are working with Adult Care Licensure on getting some language together to hopefully make this program move forward for facilities to become accredited and increase that quality of care for residents. So there'll be more to come on that as well. You can move forward. These are just some of our legislative priorities for 2026, our short session. Right now, we all know how things stand over there and with Medicaid. I don't know that we're going to see a lot of increases in anything. So our hopes are that we can simply maintain, if we can't get an increase, for the personal care services for those residents that need it. And that will become our focus. And again, we're going to continue to lobby for the state and county special assistants to get those rates more in line with the actual cost and the eligibility requirements for those residents. So that's kind of going to be our priorities coming up in this short session. You can move forward. Things that are coming. These are some things that we've been challenged with is the Medicaid managed care program. We've been through a lot, as our members have, learning the whole managed care piece, and it's been very challenging for providers. Some providers have went 2 or 3 months and have billed and not been paid just because of the way the managed care organizations work. So that's been a huge challenge going from Medicaid Direct into the managed care program. Tailored plans began in July of 2024, and those programs were intended for Medicaid beneficiaries with mental illnesses or intellectual disabilities or any other behavioral health needs. And those plans are administered by the state's behavioral health and local management entity, which include VIA in Western North Carolina, Partners in Piedmont, Alliance in Central, and Trillium for Eastern North Carolina, and some of parts of Central North Carolina. So facilities are challenged with dealing with multiple providers throughout the state, in addition to basic Medicaid direct through the state. In the next 2 to 3 years, it has been planned that Medicare and Medicaid enrolled residents, so dual eligibles, will likely go into a managed care program. And we're continuing to work with those organizations to ensure that care is effectively delivered. Okay, you can move forward. We also know that in the next 20 years, we're going to see the older population grow. Urban and suburban counties will likely see more growth than others. And North Carolina adult care homes and family care homes hopefully will rise to the demand of taking care of our seniors who need a place to live. And we can assist them in maintaining their highest level of functioning in a community environment versus an institutional setting, such as skilled nursing. And there's definitely a need for skilled nursing for those that need it. But there is a population that doesn't need it. And we really want to continue to educate folks to what we can provide for our seniors and those that are disabled in North Carolina. And with that, we have a fall conference coming up. We would love for anyone to join us that would like. It's going to be in beautiful Wilmington, and you're welcome to participate and learn more about our industry and what we do. And with that, if you have any questions, or I'll turn it over to Francis.
Thank you, Stacy. I know you're on tight time frame today, so I don't know how long you can stick around, but certainly a very informative session. One thing I just want to mention also, we talk about state county special assistance. That is 50% state funded, 50% county funded. And
Yes.
when we talk about the discussions that are going on right now in North Carolina with property taxes, which funds a lot of these types of services locally, that has implications for state county special assistance, as with all services that counties put funds into. So we'll talk more about that also. Since Stacy's going to have to leave, I tell you what, we'll hold off, and Francis, we'll do questions after you if you want to.
Yeah, and I can hang on for another 15 minutes or so.
Okay, all right. Francis, turn it over to you. Thanks for being here.
Okay, thanks. We're just want to start out by saying and thanking Stacy for doing such a great job with the advocacy pieces that we're going to all be working on together. The Incala and the Senior Living Association have worked very well together. A lot of that comes from Jeff and I both retired when I went back to work for the adult care licensure section. Jeff Horton was actually my COO. And so whenever Jeff came to the Senior Living Association together, we agreed that we would actually work for what's the better a solution and work for all things good for all seniors in North Carolina, regardless of payment status, regardless of where they live, where they're coming from, and that we would be aligned in senior care, and we have done that, and I certainly appreciate Stacy and the Senior Living Association. So I'm not going to repeat a lot of the similarities that we are, but I have taken some notes from Stacy and maybe can point out. I'm somewhat of a data nerd myself, so I can point out some of the things that are drastic that I believe as I go through mine that have changed over the years. I went back to work for the state in 2007. And I remember in 2007, in the adult care licensure section, we had 610 licensed communities that were 7 beds and greater. And we had a little over 600, 601, 602 up and down there, of family care homes that were licensed. And today, or yesterday, we got those statistics again. So again, in 2007, around 610 7 beds and greater communities and right around 600 family care homes. And today there are 569 licensed communities that are 7 beds and greater. And there are only 514 family care homes that are 2 to 6 beds. So the numbers, not only that Stacy shared in residents who are living in our communities, but actually the numbers of assisted living and family care home beds have decreased significantly in 15, 20 years. And at the same time, we're all aging, including, myself as a senior and looking for how I would fit into this continuum. I'm still working and I love it and I don't want to quit, but at some point, I'm going to probably need, as several members of my family have already, assisted living. And I fall in that area where I make my um, set or if I were to depend on my fixed income, thank God I still have a W-2, but were I to depend on my fixed income and looking for care, would make too much money for assisted living today. And I don't make enough, and I don't mind sharing. I do all those, the W-2s, the state, the little stocks and bonds that I have, I don't mind sharing, do not add up to $10,000 a month. So that $10,000 a month and greater, we see every day and what it costs lots of folks in the private world. I don't have that kind of money. So for those residents and those people out there in North Carolina, and we're growing in numbers, that this affordable being able to have affordable housing and being able for Medicaid to afford to pay residents who are on Medicaid and receive or Medicaid beneficiaries, it's really very important. And so that's where I wanted to start. And I'm just going to go through my slides. I think we're where you guys can see them now. And just a little bit more of some differences. Our mission is the same. We're here to serve. We serve the members who belong to our Incala, as well as the beneficiaries and the customers and the consumers who utilize those services. One thing that is a little different about us is not a little different, but a lot different. We at Incala belong to a national parent association, and that parent group is Argentum. We're have at least 40 states under the Argentum umbrella, and we do have a lot of support from Argentum. The Incala is a 501c6 trade association. We also have an education foundation. We currently have 350 provider members and over 90 partner members, and those partner members are our vendors and folks who sell goods and services to our providers. And in our umbrella, we have about 16,000 residents in our communities today in North Carolina. We have a lot of state and federal advocacy, and I gave the pitch for what we're going to be advocating for this spring, hopefully, whenever the General Assembly gets back in session completely, they will be able to take up some of our advocacy issues. I'm hoping for lots of things, but we may not get lots of things out of this coming session, but we certainly want to get our voices out there. We want to be on the table with special assistance and eligibility and increasing special assistance. We want to be on the table for increasing personal care rates because we desperately need it. And as the cost reports have shown for years, we are desperately lagging behind what the communities are able to do, and we're lagging behind in the reimbursement. And that can't keep going on forever. We just noted significant drops just in 15, 20 years of the numbers of licensed beds. And it's as Stacy attested to, is there's not a way for our providers who serve Medicaid, who serve 80 to 90% Medicaid, to continue doing that if there are not changes very soon. So I think, and my task in this part of this presentation was just to say more, where does assisted living actually fit into the continuum of care? Stacy went through what is assisted living. The main difference that I like to contrast with and compare is with, and because we get this question a lot, because there's a lot of independent housing, multi unit houses, and they are called independent living. And so that's where we'll start with, is with that. The independent living communities, and they're coming up every day on every corner just about, but they are not regulated by the Division of Health Service Regulation. And they're not monitored by the county, and they're not supervised or regulated by DHHS, adult care licensure section. And in those independent living communities, those individuals who live there can access scheduled care, but that is scheduled care. It is with a local home health agency, or they can hire folks to do that. But that's the difference between assisted living and independent living. Basically, is independent living can have access to services, but they are on a scheduled basis. For us in assisted living, adult care, known as adult care in North Carolina, is the 24-hour care, and we have unscheduled uh, care needs and unscheduled mornings ringing the call bell, and unscheduled medications when someone needs a PRN during the night. So that's the distinction I like to make, is the scheduled versus the unscheduled. But so 24 hours, 7 day a week, around the clock, supervised care is what we will known as assisted living. The statistics I want us to look at on the slide basically is that in our assisted living communities across the United States, based upon 31,000 communities that were surveyed, 71% female, 52% are age 85 and over, 16% of those 31,000 is memory care. Theirs is 37% independent living, and 47% of those folks are assisted living. So it's basically the breakdown. As you can see, there are more and more independent living buildings, but those folks in North Carolina are really, a lot of them are very, very sick, and it is cheaper, but they are having serious health problems, and the state has taken a very active role in following up on complaints and following up on, although they don't have the direct regulatory ability to shut them down, they certainly can follow up on situations where residents are in an independent living situation and they need to have more care than they're receiving. We talked about these statistics. I won't say them again. I'm going to move on to this slide's a little old, and you can see again how the numbers that Stacy and I just gave you have dropped since this slide was created. And the slide was created by Argentum on a national level, but they pulled out North Carolina statistics. But this was several years ago. Residential communities at that time were 550. I think this was a 2023 slide. And today we had 514 in North Carolina. So again, losing beds and losing opportunities and homes for our residents, licensed beds. Caregivers and other employees, I think this is an interesting number, is 59,000. And if you were to look at the 47,000 of seniors served, that is about almost a staff member per resident, and that includes around the clock staff. So that's why that number is where it is. The workers needed by 2040, 146,200, and this is North Carolina by 2040, and that's not far off. Economic impact is $7.5 billion. Assisted living is the most affordable choice for senior care. The average in North Carolina, as the most recent data, was around $5,350. The nursing home close to 10,000, maybe even more than 10,000 now, but this has 9,733. And then home care, we really appreciate having home health aides and our folks who are able to live independently at home with the services of home health. Well, the cost of home health is very significant if one has to have 24-hour service and have to pay and does have to receive around the clock care. That becomes very expensive. Why assisted living matters. This the high satisfaction survey, I do want to note that it's based on a survey of 400,000 residents and families, not in North Carolina, but across the country. And 90% of the residents report a high satisfaction. Over 85% of families report high value. 70% report improved health outlook, and nearly 75% report improved quality of life. And 95% of the seniors feel safe. And Stacy mentioned the accreditation pilot that Senior Living and our associations have completed for the last 4 years. And our own, although the surveys and the samples that we have, the participation that we have is small, so we cannot say that it's statistically significant. But every one of these areas in our satisfaction surveys matched up with these types of numbers. Mostly, we have those folks, families and residents, who actually are satisfied. We hear lots of bad stories, and we have very serious outcomes. We have very serious things happen to residents in assisted living, but mostly our own North Carolina, a very small accreditation pilot, came back with those communities who were accredited and did go through the accreditation process. The results of senior satisfaction was high. Now let's just move on a little bit to how it saves the taxpayer dollars. Assisted living saves Medicaid $43.4 billion a year. Assisted living saves Medicare $15.4 billion a year. Assisted living reduces lost work productivity, 43.9 billion each year. And then basically the one that's really significant, I think, for North Carolina for us is that North Carolina Medicaid savings is $3 billion a year. And this was a national report, but it was based on the value of assisted living for America. And these will be on your slide. You will have the slide deck. So if you want to look up some of these sources of these studies, again, they were prepared by Argentum for North Carolina. So population of growth is not news to us, but this is interesting. For the first time in U.S. history, older adults are projected to outnumber children by 2029. That's 3 years from now. Older adults are projected to outnumber children by 2029. So that's staggering. And then we're looking at the numbers from 2006 to 2060, 2016 to 2060, excuse me. The age of, it's going to increase, the age of over 85 is going to be greater than 198%. So again, back because I stumbled through that, from 2016 to 2060, the population of those over 85 are going to be, it's going to increase 198%. The workforce crisis. Cannot have a presentation without talking about workforce and how the shortage is. And it's not a mystery. And when that's one of the reasons too, I think that some of our folks have turned in their license or sold their bids or just got out of the industry completely is that they can't afford to pay the wages that caregivers deserve and need and should have if they operate basically a Medicaid um, assisted living. And I hate to say this over and over, but that is the significance of everything that I think in my presentation today that points to how much we need to really all of us get together and fight for Medicaid and fight for special assistance increases because the numbers show how much we are in need and will continue to be in need. Um, Assisted living is cost effective. We've shown that and we've talked about that for the state as well as for the federal government. Our advocacy efforts, both here in North Carolina and on the national on the national level, is the workforce shortages, education opportunities, recruiting, and immigration. And we have worked with Senior Living Association and with other nursing home associations, Leading Age, folks here in Raleigh, uh, working and talking about um, where are we going to get the folks to fill the seats. Their community colleges have great programs. We at both associations offer and are able to teach the 80-hour course for PCA. But we just don't have people to fill the seats. So we have to look at outside the box, and immigration plays a huge part in that and will continue, I think, in the future as far as having individuals that will work and care and work in our assisted living communities. We want to limit regulations where possible, trying to lower the cost, and then what we focus on is telling our stories, just like I know many of you did last year and will do again this year in going down to our own General Assembly and telling our stories and your stories and of of the need for those for our advocacy asks. And so we are the Incala, and this is us. And we would like to invite you to our conference. Our fall conference is in October. It's at the Benton Convention Center, and our website. Go on our website, and anything that we can help you with, we will. And now I'll hush so we can answer some questions. Thank you very much.
Thank you, Frances. Appreciate it. Stacy, you still on also? Sandra, do you see her on?
No.
Okay, I know she was on a real tight time frame.
Yeah.
Frances, can you you've done a lot of work in recruitment of international workers. Can you say a little bit about what you've done? Did you hear the question?
Yes. Can you hear me?
Yes.
Okay. Yes. Thank you for asking, Mary. I have, for 35 years, worked with recruiting international nurses and started in Durham, North Carolina, with a new nursing home. And that was in 1991, opened a new nursing home with 200 and some beds and didn't have nurses. There were two other providers larger than I, two guys, and they opened in new nursing homes in the Durham Chapel Hill area at the same time. So none of us had nurses. And at my desk, I was sitting at my desk one day, and across the fax machine came a recruitment flyer said, "Do you need nurses? Do you need registered nurses?" And so that's the gist of it and how we got involved. So those two gentlemen and I said yes, and we talked together and worked together, and we started and we recruited for Raleigh, North Carolina, specifically for Durham, foreign-born nurses. And we did very well. And then the nursing shortage sort of leveled off, and I just went on about my business of working on my career and didn't do anything else. But several years ago, when CMS was saying and talking about having for nursing homes having to have 24 hours, 7 day a week registered nurse coverage, then that opened up the recruitment possibilities again. And so since that was probably 2022, 2023, one of the nurses that I recruited 35 years ago and I are still close friends and colleagues, and we started a recruiting company again. And so we've been very successful. I know immigration is really something you see on the news and you just say, oh my no, oh my goodness, it's not going to be any good. It's not going to work. What's happening to all these good people? And I wonder those same things too. But legal immigration is moving along. We have 8 nurses in nursing homes in North Carolina today that's been here for a year. We have 8 nurses coming to Arlington, Virginia this year. And we have another 10 nurses in Ghana that and 10 nursing assistants. We started a nursing assistant school in Kenya. And so we have folks in the EB3 pipeline, and we just got notice of the EB3 is when the individual is able to come with their green cards, but it usually takes 3 years. So our nurses and CNAs that we filed for last June 1st, we just got news that they will be reviewed in 2026. And we were not expecting that until 2027 or 2028. So that shows movement in the immigration process. So with Argentum now, what our goal is, what Encala's goal is with Argentum working with us, is to figure out how we, the providers, can do like I did 20, 35 years ago. The reason myself and the 2 gentlemen, Don Beaver and Don Angel. Don Beaver owned the Bryan Centers, and Don Angel owned other nursing homes in the area. And so what we did was we had, this was the 3 things, and this is what I say today, this is what Argentum, and I hope we can say with every operator, every owner operator out there, have control. We had control of the checkbook, we had control of the nursing homes, and we put our names as sponsors. For instance, Messer sponsored over 100 people. That was not just nurses. That was their families as they came. Immigration was a lot easier 35 years ago. Mr. Beaver and Mr. Angel sponsored about the same number over those years. But we were able to do that. What's happened today, whenever I face and go to corporations and nursing homes and large folks, they are hesitant to say, yes, I'm going to sponsor an immigrant. You know, I didn't think twice about it 35 years ago, and I didn't have anybody telling me I couldn't. And I didn't, and I couldn't do it. So that's what Argentum's working with. If we can do that, if the individual organization will sponsor, and it's not that difficult, you just have to turn over your financials. Well, the federal government gets them anyway. So USCIS wants to see that you have the money to support and sponsor an immigrant. It's not that difficult, but it's that hesitancy that I didn't have 35 years ago. But anyway, so that's what, if we do it that way, if the employer is involved, the employer sponsors, then the legal fees, the move-in fees, the transition fees, those things are shared as operational cost. And it doesn't look like, well, I have to pay $30,000 to get a nurse. Well, if someone paid $30,000 today, it would cost $25,000 to get them here, unless all those things are working. But that's the goal. And Argentum is, as I said, we have 40 states. We're going to sit down and have a round table, and I'm going to try to encourage folks to step up and be that owner operator. I'm not an owner operator anymore, but be those folks who can. And the 4 nursing homes that we have nurses in Raleigh are individual owners, individual operators. They're not corporations.
Francis, there's a question in the chat about how does licensure for international nurses and nurses assistants work in North Carolina?
Okay, good question. We have fashioned our CNA program. It's after the OBRA standards for nursing homes that were written in 1987, but it is a much more in-depth process. But they will, and that's what we're working with the division, with the department now, is when those folks get here, they're trained there. When they get here, how can we make it easier for them to take the test or to do a skills validation and then be a nurse aide? We know they can come and go through the PCA course and work as PCA. So, but that's something that we'll work with. We do not have a nursing assistant in the United States yet, but we will within the next year, and that's what we're advocating for. But the folks and I will send everyone, Mary. I'll send it to you. I don't have it on my fingertips right now, but there was Dr. Grabowski from Harvard University published in 2023 a study of the 10 preceding years of nursing home nurses and foreign born registered nurses. And it's just amazing of the quality, the tenure, the compassion that is demonstrated in this Harvard study. And everything in that study aligns with what we went through in Durham, North Carolina 30 years ago.
Okay, very
And
good.
so I will send that and you can send that out to everybody.
Super.
I've probably shared it a couple of hundred times.
Okay, that's great.
That
Well, I
is great.
appreciate it. So I want to see if anybody has questions of Frances. Like I said, it looks like Stacy, I know she had to go, but does anybody have questions for Frances? I mean, I think you've heard about, particularly with legislative issues, one of the big issues certainly is the state county special assistance rate, and workforce issues are certainly, we've heard about before, are things that all facilities are facing. Any questions
Thank
for
everyone.
Frances?
I really appreciate this opportunity and thank you. And the coalition, we love the work that the coalition does, and we're so honored and proud to be members. And um, um, thanks to everyone who listened to Stacy and I this morning. Thank you.
Thank you very much. Frances, thank y'all for your membership and for your longtime support of the coalition, as well as for the Senior Living Association also. But hopefully you guys maybe learn some information today that will help as we go through and advocating for issues at the General Assembly. Because, as I said, this is things regarding assisted living are issues that come up just about every year and likely to come up again. So, Frances, thanks again. Appreciate it. All righty, so let's change gears a little bit. We're glad to have another presentation today. You know, we do member our partner spotlights at most meetings, and today we're pleased to have a presentation by someone from UnitedHealthcare. You know, UnitedHealthcare has been a longtime partner with the coalition, and they've been great to work with, and has just been very supportive of our efforts over the years. And today we've got Dr. Rashma Gupta. She is Community and Health Medical Director for the North Carolina UnitedHealthcare Community Plan. And welcome, Dr. Gupta. We're glad to have you here. And you're going to talk about empowering the aging community, addressing nutrition and food insecurity across North Carolina, and some of the things that you guys are involved in. So thanks a lot for being here.
Yeah, thank you for having me. Okay, I can share my screen then?
Yep. Hold on just a minute. Let me shake
So
that back.
we've got your slide deck for sure.
Yes, you should be able to share now.
Okay, let's try this out.
There
There
we
we
go.
go.
All right, perfect. So you can see my screen?
We can.
Yes.
All right, awesome. Okay, well, yes, again, thank you for having me. This is my first I didn't know about these meetings, honestly, but it's been I've been learning a lot, and it's been really
Great.
interesting to hear the topics in the presentation previously.
And we usually have other folks from UnitedHealthcare, so all y'all come. If
Oh
you're
yeah, now I know. So yeah. All right. So yeah, with actually March being Nutrition Month, we figured I'd talk about nutrition because we know, and we'll get into it, but the connection with chronic disease and also then that link with food insecurity. And so All right, so first I'll just give a brief snapshot of UnitedHealthcare and what community plan entails. Talk about a little bit about nutrition and dive into food insecurity and then the strategies that we employ to help combat food insecurity or to help support folks going through food insecurity. And so the community plan includes three lines of businesses: Medicaid, dual eligible, so Medicare, Medicaid, and then IFP, which is the exchange plan, the individual family plan. And so our health priorities, we work to align with the state as being kind of the implementers of the state's with the state's guidance. So our priorities are behavioral health and resilience, child and family well-being, and a strong and inclusive workforce, which we've been talking a lot about workforce. So the community plan, so the largest population is Medicaid, followed by the dual eligible. And so right now in the state, there are over 650 covered lives. And so to talk about then for these priorities, so one, there are various value-added services, which I'll talk about a few. They're not covered by traditional Medicaid, but that work that we employ to help members live healthier lives. And we work to then improve various communities. So over $15 million dollars have been invested for access to care, affordable housing, expanding behavioral health, and as we'll talk about, to help with food insecurity. So these are just the usual things that are covered with a health plan. And again, it'll really be talking about the value-added services. So to go into food as medicine, so right there's generally before it was more so talking about nutrition. Wellness industry has been growing, but now there's been a movement over, I would say for some time, definitely 10 years, but I feel like accelerating more so on food as medicine. And so what that means is that it's integrating nutrition into healthcare, right? So before they were almost separate buckets, but really that nutrition can not only prevent, but also manage and treat chronic diseases. And so there are now various large studies, systematic reviews to link healthier dietary patterns with improved cardiometabolic outcomes. And again, this has been accelerating across health systems and even in policy. And there are various trials that show that food as medicine programs not just improve health, but actually help with improving food security for these people with chronic disease. And so sometimes the question is still, well, is nutrition really a treatment? Again, or is it mainly for prevention or mild disease? And as a physician, as an endocrinologist, I've seen it, right? And so again, it's like, okay, this person who's on insulin, but their blood sugars are still all over the place, getting very high, then low, they're feeling bad. Will them stopping their sugar sweetened beverage really make that much of a difference when they're kind of already on that, more uncontrolled and not just the mild disease or diet controlled diabetes? And so studies, oh, it didn't move it. Let's see. There we go. So studies have shown that people with type 2 diabetes with medical nutrition therapy, so getting that nutrition education and implementing it, can get an A1C reduction of 0.3 to 2%, with typical being 1%. Well, guess what? That's just as much
Significant.
as some medications. And for prediabetes, a randomized controlled trial meta-analysis showed an A1C reduction of 0.3 versus usual care. And when your A1C is that low, right, when you're in that prediabetes range, that can make a substantial difference. And then what about for blood pressure? I was listening, well, and just my own experience as well, but also listening to a podcast of a physician describing, hey, I had this patient and has the blood pressures were so high, concerned about that this person would end up having a stroke, despite them being on their medication. And the person is saying, well, no, I really am taking my medication, I swear. But right, it's not seen in the when they were coming in. Well, in digging and asking and getting that full history from the person, well, it turned out they were having to eat a lot of canned foods. And we all know how much sodium is in these canned products. And so when I keep changing the wrong side. Okay. There we go. And so when we look at blood pressure reduction with sodium reduction, so DASH, limits sodium, restricts sodium to 2,300 milligrams a day, or 3,000 milligrams a day. And so comparing that with low sodium DASH, which then further limits sodium to 1,500 milligrams a day, you can see that there is quite a difference of systolic blood pressure reduction with that higher, still limited than say most people probably have, of sodium per day. So the first one will bring that systolic blood pressure down by about 5 points. And then restricting it even more brings it down by 11 points. And again, that's almost as much as some medications. And then if somebody starts off with a higher blood pressure where their systolic blood pressure is above 150, well, wow, right? You can get a 20-point reduction in that systolic blood pressure. So me, even as a believer in food as medicine, like just to see these numbers is still remarkable. All right. And then what about with going to GLP-1s? Well, do we still need the whole lifestyle interventions? Do we still need nutrition support when these are almost like miracle drugs, right? It's like everything you see and hear is like everybody should essentially be on GLP-1s, would be what, you would think from all this. But it is, I would say, even more important when somebody is on a GLP-1 because their appetite and food intake gets reduced so much, but it doesn't mean then that they're taking in the appropriate macro and micronutrients. And so still getting adequate protein to maintain lean mass and then function as well. And that's actually especially true for older adults that they, without that protein intake and maintaining muscle mass, that there are more risks for falls. There are more risk for fractures because of then also usually not getting enough calcium and maintaining bone health. And so then, even if somebody is eating less, and so getting less calories, that diet quality is still important for blood pressure, cholesterol, blood sugar. So again, just that nutrition is still very important, and that nutrition counseling can help with the GI side effects with GLP-1s, and so helps people to be more successful and be okay with staying on it long term, which is when you really are going to see the benefits. I'm going to skip over that one because we essentially went over it. And so when we talk about, so especially then with the Medicaid population, DSNP population, food insecurity, I mean, just generally, food insecurity is a huge problem. It affects about 13% of US households. And it is a clinical issue. So it's just because it's associated, as we just talked about, that connection of food quality and cardiometabolic health. And so for folks who are food insecure and they're doing the best they can, but guess what's usually available and what's usually less costly for people are going to be the more processed foods, packaged foods that are higher in sodium, higher in added sugars, carbs, etc., less in fiber, right? So that poor diet quality leads to higher rates of diabetes, hypertension, cardiovascular disease, also depression, anxiety can be in that bucket too. And so this poor diet quality leads to higher healthcare utilization, higher healthcare costs, and as we just kind of talked about, can limit the effectiveness of the medications that they're on, right? There's got to be that whole picture care. And so when we look at in North Carolina, the rates of food insecurity, so housing ends up being the biggest social need. That's the social determinant of health. Housing is number one. And then food insecurity is usually number two, but it's in the top three for most regions, right? So for 4 out of the 6 regions. And if we then, this is for the Medicaid population, and this is overlaying diabetes, right? Looking at a cardiometabolic marker and food insecurity. And so food insecurity being blue, so the darker the blue, the more food insecurity. And then the darker the pink, the higher rates of folks with diabetes, adults with diabetes. And so where they match, where they line up, so that dark purple are going to be the regions where both are playing a huge role. And so we can see that the areas that tend to have higher rates of food insecurity do have higher rates of diabetes. So especially right in oh geez, I get the region. So region 5, especially regions 5 and 6, you can see it. So Robinson, Scotland, Richmond, Halifax, Lenore, Washington are all counties that have really high rates of both. And so then it's okay, great, we have this data. Now what? And so there are various strategies then that combine providing food as well as in the education around it to help with both food insecurity, that nutrition education to lead to better outcomes. And so there is a food as medicine program that we have partnered with through NC State, NC Cooperative Extension, as well as Goldsboro Pediatrics. There are various nutrition classes. And with the member advisory committee, there are health education sessions to teach, for example, about reading food labels. And then the NC Cooperative Extension, there's a 6-week nutrition and cooking series sponsored by United Health, conducted by these agents. So it's really working together. And there are the areas where that nutrition and cooking series are. And then for DSNP specifically, so about 85% of folks with dual eligible are getting less than $20,000 a year. And so those are the folks, again, that we would, most in need. And so there are these U cards that is a value added service where they get credits to use in stores or online, and includes Walmart, Dollar General. So the places that are going to be more available also in rural areas, right? So that it's really trying to touch and help most members. And so for the DSNP population, their average annual value of credits gets into the 2000s. And so it includes over-the-counter wellness products, healthy foods, and then even some utility assistance. Extra benefits then to combat and prevent, well, not just diabetes, but the cardiometabolic conditions. So there are nutritious meals that are available after hospitalization. We talked about the cards available where they can get credits for healthy food. One Pass, which is a yearly gym membership. And then actually part of that is that there are virtual classes available, and even some, because not everybody wants to go to the gym or feels comfortable doing so. And so that virtual option is really nice. They also can break down the courses that are available based on conditions that they might have. Like I'll hear that, oh, well, you know what, I've got back pain, I can't really exercise, or but they have specific back pain gear, like classes, fitness classes then online geared towards folks with back pain, or chair exercises, or to do more walking, more of the things that people feel more comfortable with, so that it meets them where they're at in their journey. And then for behavioral health, there's a mobile app. Right now we're using Calm Health, and so it's more amped up than the usual Calm app that people can get, to offer on-demand help for stress, anxiety, and depression, because we also know that link with depression and chronic illness. And then we do work to have that 360 approach. So that's how we help members. And then this is how we work to help providers. There are listening sessions to explore new strategies and just figuring out how we can partner. Is it helping with data? Is it how our care management team can help assist? We have clinical rounds to see again how we can partner on specific patient members. And then there's just provider recognition program, just to recognize all the great work that folks out there in healthcare are already doing. And then the other big piece, again, to help support the great work already being done, are strategic investments to build healthier communities. And so, again, emphasis on strategic. So we want to help with those that are aligned with our goals. So Right for Revival connects food surplus farm produce to those that need it. And so then it's also giving those healthy options. There's the YMCA Diabetes Prevention Program, and then they also have a mental health program. So those are just some examples. And I'll just close it out with, feel free to reach out to me with any questions, and there's my email address.
Thank you very much. Most informative. I have a question. So are you guys looking to engage with more community partners on food as medicine programs?
Yeah, we're always looking to partner and see where things align. And usually that is through Shalita and her team. So if you have any suggestions of ones to work with, and we could see, I mean, I just gave a quick overview and of one that we work with, but there are others. But definitely feel free to shoot it to me and or her.
Okay, great. All righty. I see, Christine, you have a question?
Not really a question, but a comment, so to speak. I'm a licensed agent that sells Medicare and individual products, also appointed with UnitedHealthcare. But as far as the benefits that are on those dual plans, I just want to make sure that people know that CMS in 2026 implemented that individuals receiving those SSBCI, the special supplemental benefits for the chronically ill, they have to have specified diagnoses from their doctor to be eligible for that on their plan, to be able to get that food benefit. So they have to be diagnosed with, maybe it's heart disease or diabetes. There's a long list of them, and odds are most people are at the point that they get to Medicare, they have some sort of diagnosis like this. A lot of my clients did. But I just want to point out that it's not just available to everybody. If they don't have that diagnosis, they would not be eligible for that SSBCI.
And I believe that's for C-SNP, but not D-SNP or Medicaid. For those, then it would just be if somebody would be eligible for SNAP benefits.
My understanding is that it's for all of them. So I guess we'll figure out moving because it's a big issue.
Right. Yeah. I think for our value-added service, I know at least for the Medicaid, for sure that the food benefit is for those that meet for SNAP, but because we are keeping that the same, because we're changing anyways, different platform, instead of food boxes going to the card, and so that part we are able to keep the same.
Yeah, and I don't deal with just Medicaid.
Yeah.
The Medicare and Medicaid, those dual eligibles. My understanding is that they, for the Medicare piece, they have to have those qualifying health conditions, which sounds kind of crazy, a qualifying health condition, but.
Oh, right, yeah. But well, and I mean, like you said, most do have something. So, but yeah, I will have to look into that aspect of it. So thanks for sharing.
Thanks, Christine, for raising that. Other questions? Anybody been involved in a program that's using food as medicine or food and medicine? Okay. Well, Dr. Gupta, thank you very much for sharing with us today. We appreciate it. And again, we appreciate the partnership with UnitedHealthcare. It's been a good partnership, and we appreciate it all. Thank you so much.
Yeah, and thank you again. Thank you for having me, and appreciate all the great work everybody's doing for the communities that they're serving. So it's a lot happening.
And we're here every month.
Come back anytime.
I was going to say, we're here every month. We'll make sure that you get our meeting notices from now on.
Okay, appreciate it.
Okay. All right, Sandra, I think you're up next to start with updates.
I am, and I will try to talk slow for the interpreter's benefit. I know I get fast sometimes. Been a busy March. It's been a long March. I don't know why, but the year's gone by fast, but March has been slow for some reason to me. But to start off, I did attend the Ann Johnson Institute with the Division of Aging. This is was the 25th anniversary of the Ann Johnson Institute. And I see Janice shaking her head. She was there. Very nice event to recognize the namesake of this. You're going to see something in the newsletter coming out about that. And I know several of you on the call had worked with them in that. And I believe the statistic was there's been about 357 graduates of that program, which is specifically for senior center management, senior center directors to be qualified. And it's over a 3-year period that they attend different classes to be able to do that. So it's a great program for that. Also, the beginning of March was the UNC Chapel Hill School of Social Work offered their Legacy Speaker Series. And this year it was about retelling the story of aging. So I know Janice and Mary were there to present. Some of our other partners were there. And it was a very good information that was shared. It was a full day event. And I believe next year is going to be on the topic of caregiving. So that'll be a very good time as well. If you're interested in that, you can go to the UNC Chapel Hill School of Social Work page, and I'm sure they'll have information there coming out. I'm on the webinar cycle to kind of try to keep up to speed on different things. Two of those this month, which I need to go back and look at again to really capture everything. But are strengthening your nonprofit social media presence, so that insert businesses social media presence in anything like that. And also one on digital outreach for nonprofits. For those of you that are in the nonprofit world, there's an organization called TechSoup. And they actually offer a lot of great webinars and on different topics. So if you're interested in kind of educating yourself about different things, both of those are very good organizations to do that with. Of course, continuing to meet with the all ages, all stages subgroups. I personally sit on the housing group and on the finance group. I know a lot of our members are involved in different areas of all ages, all stages, but we're have some things moving forward. Actually, the finance group, and I don't believe Divya or Kaylee is on the call this morning from DHHS. The finance group is going to have their first series in April. We're going to have some information on that, hopefully, in the newsletter. I can't remember the date right off, but just kind of basic kind of budgeting and going to try to start a series on that financial. So when you see that, if you will share that with your various groups, they may be able to look at that as well.
I
Also,
believe it's on the 20th, Sandra.
on the 20th. Okay, April 20th. Okay. Of course, been meeting with the Older Americans Month Committee. You should see some information coming out on that. Misty Pykar is kind of our chair of that with the Division of Aging. I would throw out dates, but they're apt to change because we're working with the governor's office and the Secretary of Health and Human Services office. So, but just suffice it to say, we're going to have an event, hopefully at the governor's mansion in May. So for Older Americans Month. So there goes Misty right there. She's been doing a good job. So was that fair what I said, Misty?
That is fair. And yes, it is correct to say that anytime the governor's team's involved, it's hard to pinpoint a date and or what will or will not occur. So thank you.
But so stay tuned on that. Also, yesterday, I was in Raleigh anyway, and Meals on Wheels of Wake County had an open house at their facility there in Raleigh. And if you've never been, it's not just that facility, but that's tremendous what they are able to do on a daily basis in distributing the food that they do and how they prep everything. And the number of volunteers to help pack the food, the number of volunteers that they have to deliver the food. And some of the stories they were talking about, and I know it will not surprise any of you on the call, for some of the folks that they're delivering to, it's one of the few contacts they have during the week with someone. So that was a really good event to kind of learn about how they are doing that. And of course, there's different Meals on Wheels programs throughout the North Carolina, and of course, Meals on Wheels on Wake County and Meals on Wheels of North Carolina are both members of our coalition. So that's why I wanted to point those two out specifically. I think that's all I have for right now. And I will talk about the Equity Committee in a minute when we get to that part, unless you want me to do it now.
Yeah, go ahead and do it now.
Okay.
Be fine.
The Health Equity Committee actually had their first in their speaker series on March the 13th. We had the representatives from the Office of Minority Health and Disparities with DHHS, and Sandy Leathers, Danita Nash, and Juan Ortiz. I think I saw Sandy on here a few minutes ago. Did a great presentation on the various things that they are working on and talked about the most recent report they had, but their topic was healthy aging for all, addressing health disparities and strengthening health literacy in North Carolina. That PowerPoint and the recording of the meeting is actually on our website now. It's on the same page you find our member meeting videos. So if you have a chance to kind of take a look at that, please do. So very good information, and I think it's a great partnership that the Coalition's Health Equity Committee and the Office of Minority Health is establishing there. And our next hot topic that we have is going to be on May the 8th. And that's under the health equity umbrella. And I will let Lindsay Golden, who is going to be our speaker for that, just give kind of a brief update on what she's going to be talking about for that May 8th date.
Good morning. So on May 8th, we want to take advantage of Older Americans Month and also hit on a topic that's really important in the current conversations, which is around brain health. So we're going to be talking on building healthy brain habits during Older Americans Health and really how you can empower yourself and loved ones around you to take control of your cognitive health. We've had a lot of progress in the last year with clinical trials that have been done out of North Carolina with the U.S. Pointer Study on things you can actually do to improve your cognitive health. So really excited to talk about some of those next month.
Very good. Thank you. And of course, we'll have that information also in our upcoming newsletter and calendar of events. Also, the next Health Equity Committee is meeting on Friday, April the 10th from 9:30 to 10:30. If you're interested in joining that group, please let me know and I will get the information to Daryl Fulmer or to Rosalie Calarco, who are the co-chairs for that group, and make sure that we get you involved. So anybody have any questions? I do want to point out something on Dr. Gupta's presentation. One of the counties that she highlighted, Washington County, as having the high incidence of food insecurity and the diabetes, is my home county. And it's interesting because I was thinking about growing up, how many people of all economic levels had gardens. They used to have, grew their own fresh vegetables. Now, albeit they probably seasoned it with some salted pork or something like that, but they still had fresh vegetables. And I was just thinking when I saw that map, it would be interesting to overlay 30, 40 years ago, the incidence of diabetes and the food insecurity, and what difference that may be. It also made me think when we are tasked with getting doing food drives and asked to bring, cans of food, maybe we need to start thinking about the low salt versions or the no salt versions to be able to put into there, because I think that would also help in that delivery. And if I keep on talking, we're going to run out of time. So I'll be quiet and turn it back over to Mary.
Yeah. Well, Sandra, I'll just add that I also am from northeastern North Carolina, as you are, and everybody in my community had a garden too, and we all had vegetables and things like that. But our position was it wasn't good unless it had a skim of grease on top. So I don't think that those diabetes numbers and blood pressure numbers and things like that were any lower, probably because of the fact we seasoned everything to death. So anyhow, so as Sandra mentioned, we've got a newsletter coming out. It will probably be out. Might send it out over the weekend and resend it again the first of the week, but be on the lookout for that. And then she's going to do a calendar also probably next week too. One thing I want to point out about in that newsletter, because it's got a time deadline associated with it, is the Division of Aging is recruiting for a deputy director. And the closing date for that position for anybody to apply is April 1st. So if anybody's interested or know anybody who's interested, let them know. And as soon as we get out the newsletter, it will have the link to the application and all the information about that. So please share that with folks widely. Also, I want to congratulate Teresa Troop and the Division of Aging, and I think the North Carolina PACE Association. Teresa's with the North Carolina Adult Day Services Association, and also I think North Carolina Adult Home Association. All those folks put on a marvelous conference in Winston-Salem this week. So appreciate the invitation you gave me to come and speak, and thank heavens for letting me do it by Zoom. And it worked out fine. So it was a good conference. I think about 170 people were in attendance. So Teresa, I don't know if you want to say anything about that or not, but it was a great conference, and the first time something like that's been held in a good while now.
We were thrilled with the response, and we really appreciate your support, Mary, and involvement of some of the folks who are actually on this call today. And to be able to have the people who we interface with in adult day centers, the county monitors and the specialists from the health department and the providers and the state leaders, to be able to be in the same room and have conversation and share. Adult day centers, it was just interesting to hear assisted living. Those programs are closing. They're reducing their numbers in the family care homes. Adult day centers are experiencing the same thing. And another center we've heard is going to be closing at the end of this month. And so it is so essential that everybody's working together. So we were thrilled to have that opportunity, and we appreciate your support.
Right. And we know it's disheartening to hear about facilities and programs closing, because we know the demand's going to be out there for these services and things too. Something else is going to be in the newsletter, just want to point that out, is the National Domestic Workers Association, which is also a coalition member. They are doing rallies around the state on May Day, May 1st, to draw attention to issues regarding direct care workers and direct care in North Carolina and across the country. So be on the lookout about that also. Sandra also mentioned about maybe an Older Americans Month. The Administration for Community Living has come out with the theme for this year is Champion Your Health. So there are lots of materials online through the ACL, Administration for Community Living website, if anybody wants to check those out. And they always have good things available. And last, I'll just mention that, we told you we're in the process of recruiting for a new executive director. Sandra's moving over to the operations director position. We have finished the interviews, and hopefully we'll be in the final processes of selecting someone for that position. We're very, very excited. We had great candidates to apply for the position. So it was we were very lucky in that regard. So be on the lookout probably in the next, at least within the next 3 or 4 weeks relative to an announcement relative to that. Anybody else, as Sandra says, have any questions for either Sandra, myself, or anybody else on the board? I see some other board members here about the coalition. Okay, well, let's move into talking about what's going on and basically kind of legislative updates on the political arena, both at the federal and state level. I will start off, but I see other folks on this call who probably have a lot more information than I do relative to things going on, but I will start it off. So it's been an interesting last couple of weeks for sure. So we had the primary elections in North Carolina, 1st of March, and we know that we're going to have somebody new is going to be the President Pro Tem of the Senate. Senator Berger, who had been President Pro Tem of the Senate for 15 years, lost by 23 votes in his primary. So, and he did concede to his opponent, who was the sheriff of Rockingham County. Already 3 people have thrown their name in the pot to be considered for the next Speaker Pro Tem, and there probably will be more. So it's going to be an interesting process to see what happens. The General Assembly is going to be coming back in on April 21st to start their short legislative session. Now, it's anticipated that it probably is really going to be a short session. And one of the primary reasons for that is this election year. And as we always tell everybody, when you look at poll numbers for elected officials, people in General Assembly, their poll numbers are always worse when they're in session than when they aren't. So no one wants bad poll numbers going into an election. We think they'll move swiftly. We don't know if they're going to take up things of substance or not. We would hope they do a comprehensive state budget. I have heard through the grapevine they might be doing some more mini budgets like they have done last year. So we'll see what happens. We know we've still got programs in North Carolina that did not get funded last year because of the fact they were doing the mini budgets. So it is going to be interesting to see what happens. We know one thing that we certainly hope they're going to take up is addressing the shortfall in the Medicaid program. Medicaid is projected to have, and all the numbers are indicating this is a true projection, a $319 million deficit for Medicaid for this state fiscal year. So that's not even going into next year. This is the year we're in. Medicaid projects that without that added funding, sometime around, in May, early May, they probably aren't going to have enough resources to reimburse providers at the rates they need to be reimbursed at. So that's a tough issue, that's for sure, and one we certainly hope they will address. One of the big issues is going to be about what's going to happen with how they're going to approach a tax cut. Senator Berger has been very interested in having an increased reduction in the state income tax. In fact, a couple of years ago, the General Assembly put in place kind of a staggered reduction in personal income tax. And we've got additional tax reductions that are to go into place if General Assembly does not take action. Now, the economic forecast for the state, revenue forecast, came out this week. And this is done by the Office of State Budget and Management and the Fiscal Research Division, which is nonpartisan at the General Assembly. And they agreed that that right now for this fiscal year, we are projected to have a $370 million surplus due to a strong economy. However, going into next year, it's going to be a $360 million reduction from what we had this year. So we know, we've talked about this at previous meetings, we know next year is going to be a tough year. What's the HR1, one big beautiful bill provisions all of them kick into effect, particularly Medicaid. And North Carolina, as we've talked about in the past, is projected to have a $50 billion reduction in Medicaid funding over 10 years. So if we start with those cuts, we also know that we are going to have cuts in food stamps. They're projecting that it's going to cost, the state is going to experience, I think it's $16 million added administrative costs for food stamps, and counties are going to have $69 million increase in administrative costs for food stamps. But also we could have a huge added cost on top of that. There's a provision in the One Big Beautiful Bill that says if a state has an error rate for food stamps above 6%, then they've got to start paying part of the administrative cost. Last time I heard, North Carolina's error rate was 7%. So this could be millions of dollars that the state might have to come up with if we continue food stamp benefits at the current level, if we don't get that error rate down below 6%. And I know the state is doing everything they can, and counties are doing everything they can right now to try to get it down. So, and as I've told you before, I used to do food stamp eligibility. It is impossible not to have an error rate almost. When you're dealing with people and reporting income and, just all the things that go on in that process. So it is a tough situation. So Speaker of the House, Dustin Hall, as well as the governor, are saying we cannot afford another tax break. And Senator Berger is saying, yes, we could, because that's what's making the economy strong. So and that's what's been holding up the development, primarily the big reason that's been holding up the development of a comprehensive budget is there cannot be agreement on whether or not to take an additional tax cut. So it's going to be interesting to see what happens at the state level. If we do think it's going to be a short session, as I said, but we hope they're going to take these actions. They'll probably take at least some actions. The other thing that probably will have some recommendations coming for legislative action this time is with the property tax committee that was formed by the House. It was a House Select Committee on Property Tax Reduction and Reform. Now, we have been really, really excited about this and hoping that this will be an opportunity to get increased eligibility and income exemptions for older adults and persons with disabilities who qualify for either, who want to qualify or need to qualify, can't afford to pay the taxes for the homestead property tax exemption or the circuit breaker program that are currently in existence. Quite quickly, that debate inside that committee turned from things like, in fact, it never even got off the ground talking about these exemption programs. for older adults and persons with disability. It quickly turned to a discussion about the role of property taxes in North Carolina, the feeling among many folks that they think property taxes are out of hand in the state and that they need to be reined in. And, it's become a real big political issue. Counties and the league of municipalities, counties, municipalities will tell you that property taxes are the number one flexible source of revenue they have to cover programs and services and essential things they have to cover. And we talked about earlier today about how like state county special assistance is 50% county. And we know that many counties, particularly low wealth counties in rural areas, are very strapped right now to come up with adequate funding to cover these essential services they do. And unfortunately, a lot of these rural counties have some of the highest tax rates in the state because they don't have other revenue sources like user taxes and things like that they can generate a lot of revenue from. So this committee, the House committee that's been meeting, they're probably going to put forth about 3 bills. They have not voted them out finally. They've got a meeting coming up in April where they'll do this. But one of the bills they want to look at is kind of scaling back some of the tax exemptions for hospitals, nonprofit hospitals. Another would be scaling back exemption for some of the low and moderate income housing that's in North Carolina and some of the loopholes that's kind of existed in that. And then the third thing, which they'll probably do, is put a measure on the ballot for a constitutional amendment that will give the General Assembly the authority to control or to put limits on what can be done regarding property taxes. Now, basically what this would do is take the decisions, some of the decision making out of the hands of local people at the county and city or municipal level. So it's going to be a tough thing. There was a poll that was just released the last couple of days that shows that almost 75 to 80% of people in North Carolina would support this constitutional amendment. It's interesting in the General Assembly discussions that are taking place. You've got a lot of legislators who've been former city officials, city council members or county commissioners. They're going, wait a minute. They're saying, well, hold on, there's got to be ways of addressing this issue without throwing the baby out with the bathwater. And then you've got others that really, really want to dig in and say there needs to be limits on what counties can do. So that has implications, I think, not only for critical services in a county, which we think aging is, but like a lot of local aging programs get county or local funding. So this could have major implications about things. I know I have relatives in other states that have levies, which is what this would be looking at, that they find it very difficult to fund capital needs for things like build new schools or to replace water and sewer systems, that type of thing when they have levies. So there's pros and cons both ways. This has got major, major implications for local finance in North Carolina of what will be coming. Just another thing on the federal level, it looks like y'all probably heard the news this morning. It looks like they probably have worked out some agreement for funding a lot of the Department of Homeland Security, particularly TSA agents and Coast Guard and things like that. But still, the issue about ICE and customs enforcement, I don't think is resolved yet. But that has implications for all programs too. Senator Tillis has announced, of course, that we know he's not running for re-election, but he's also said that he will not seek public office again. So that's an interesting thing, I think, too. But anyway, I'll stop there and there's people on here who know more about federal and state stuff than I do, and I'll let them add in things they want to share on this, things they're hearing, either about legislative session or about things in Congress. I know you guys know more than I know, some of you. So appreciate y'all saying anything.
Lee Dobson says you've done a great job. She put that in chat.
Well, thank you, Lee. I think one of the things that we've got to remember in this process, we've had a lot of uncertainty in the last year about things. And that uncertainty is playing out into where we are now. And some of the actions that were taken, particularly on HR 1, not passing a comprehensive state budget last year, these are things that we're now seeing going into this fiscal year also. So it's kind of like we have things that are, you know, well, where we are today is influenced by where we were last year, and they're going to influence things going into the future. But I do think, as far as the state is concerned, it is really going to be the General Assembly is going to have to make some really, really tough decisions regarding funding going forward. If not this year, next year, when it comes to 2027, because we aren't going to have as much federal revenue coming in unless something changes. And if we cut state taxes again with the uncertainty we have, then that will mean that we will have less state revenue also. But anyway, in the newsletter we've got coming out, we'll kind of have a summary of all these things. We'll put more in there about the budget forecasting, those types of things. But if you have questions about things like that, let us know. I'll be glad to tell you what we know. And Teresa, I know we covered this when we were at the meeting last week for Adult Day Services folks. I hope their eyes didn't glaze over when we did all that. So
No, we were inspired. We are ready to well, you weren't there to hear my voice, but I kept saying, we the people, it's time for us to take action and to step up. And so and my son is deploying next week, so please remember our troops.
Yep,
yeah,
absolutely.
exactly.
I do want to add that all of the different committees, you can stream the meetings if you don't want to go to Raleigh or can't be in Raleigh at the committee meetings. And in our 20s and 30s, we may have had watch parties for the Super Bowl or watch parties for March Madness. I think now we need to have, as I approach my 60s, and others of us that care about the older adults, I think we need to have watch parties for some of these committee meetings as they stream to keep ourselves informed. And I think that's a huge role that I have learned about the coalition in the last year of being here, is that is what we try to do, is inform and educate. Because if people know what's going on, then they're more likely to tell somebody else, and then we can really have that discussion of what does this mean for the state of North Carolina and our aging population.
Yeah. Just in case you are interested, a couple of committees that are coming up that you might want to put on your calendar if you have time. There are two meetings on April the 7th at 9 o'clock. The Joint Legislative Oversight Committee on Health and Human Services is meeting, as I said, at 9. And then at 1 o'clock, the Joint Legislative Oversight Committee on Medicaid is meeting. And then on April the 15th at 10 o'clock, this House Select Committee on Property Tax Relief and Reform is meeting. And this is when they're going to be deciding for sure about what legislation they're going to be putting forward relative to issues. Interesting, this morning in North Carolina Newsline, which is one of the online news publications, they have a big article about from North Carolina, employee with North Carolina Housing Coalition is talking about the property tax issue and how they need to go back and look at how can you help older people and persons with disabilities, and forget some of this other stuff. But it is an interesting dialogue for sure.
Mary,
Alrighty,
Mary, what was the date of that property tax meeting?
That is going to be on the
15th, April 15th.
Yeah, 15th at 10. Yeah.
If you go to the North Carolina General Assembly website, they actually have the different committees, and there's the links to the documents, agendas and things, past meetings, and also the streaming link to be able to link that.
Well, I'm sorry I put us way over time. I get on a high horse and keep going. Sorry. All right. So, what do we got updates coming on up that you folks want to share about things you like? I see Heather Altman's hand.
Hey, just a quick note. I got a note from the governor's office yesterday. Governor Stein did officially proclaim April as Healthcare Decisions Month. So if you need any other excuse to help encourage your constituents, clients, community members to have important healthcare decisions discussions, use it as another discussion trigger.
Did you want to mention what might be coming up this legislative session? Or not?
Well, we are hoping for those of us with the North Carolina Serious Illness Coalition, and speaking of healthcare decisions, we've been trying for a long time to make it a little bit easier slash remove the administrative burdens to completing your advance directives. North Carolina is one of the 3 strictest states. You need 2 witnesses and a notary. I'll say that slower. And which just adds an unnecessary administrative burden. And we've been trying now for, I think, over 5 or 6 years to get that updated to be in line with other states. So we do have a current House Bill 349 that is in the Senate to make it 2 witnesses or a notary. And then I'm excited that the General Statutes Commission is actually putting forth provisions. This gets really long, sorry, interpreters, of the Uniform Healthcare Decisions Act, which would also suggest easing these administrative burdens. So there's 2 different pathways to get to this goal, which we thought would be a really easy update to do a number of years ago. And so some of us were asked to provide comments by next week to the General Statutes Commission for their proposal. So I'm excited that there are 2 different ways just to get it a bit easier for people to get their wishes known and hopefully honored. How was that, Mary?
Was great. Thank you.
Sorry, interpreter.
Anybody else? Anybody else got anything you want to share? Meetings or updates?
This is Janice. I got a couple of things. So we're hosting a end of life options expo here in Orange County at the Seymour Center on April the 11th from 12 to 3. I think we've got about 40 vendors for this event. This will be our second time doing it, so everyone is invited to come. So that's a Saturday, April the 11th from 12 to 3. And then for my other hat, the North Carolina Association on Aging, we're having a boot camp, and that's going to be on May the 4th, 1 to 4, and that's all over Zoom online. So hope you can join us. Oh, yay, Heather, you'll be there for the awesome.
So, Lee, do you want to announce about Public Policy Committee about No Advocacy Day?
Sure. Our Public Policy Committee met, I guess, a week or so ago, and in light of the short session, the extremely focused session on trying to get out as quickly as possible, and some other issues, the committee decided to recommend not having a formalized public policy, or excuse me, advocacy day in Raleigh this year, but we're going to plan one for the long session, which is next year. In lieu of that, the group is going to recommend and help provide some tools and resources for members to host legislators in your place of business and in the community, for them to learn about the issues that you're facing. So be on the look for some tools and some resources for you to invite legislators into your communities. And I think, Mary, we did discuss hosting an informal education on essentially how the legislative process works, just so that folks better understand not only how a bill becomes law, but how policies are introduced and move through the process, and how that can impact the work that you're doing in your communities. More on that later. Anything else, Mary, that we're
another thing I could think of is you're right. I think we are going to do an informal session. What we probably will do in conjunction with that is offer a tour of the legislative building and try to do it when there's a committee that's related to aging issues going on. And we can talk about all these things about how a bill becomes a law, legislative process, all the ins and outs of being an advocate as we do the tour. So, and this will be sometime in May. We haven't set the date yet, but we'll let you know about that. Won't be any charge for it. It'll just be an informational session. And we are not, we also decided, this is for the Coalition's Public Policy Committee, that we're just kind of going to brush off our legislative priorities for 2025 because it's, there's not going to be any need to do new things right now. So,
Yeah.
and then we'll start fresh.
Yeah, and as we know, North Carolina has a biennium budget, right? So it's a 2-year budget cycle, and a lot of priorities align with the passing of a budget. So we're in the second year of a 2-year budget cycle.
Yeah. Okay. Anybody else? Thanks, Lee.
The only other thing I'd like to mention is that Hearts for Home Care is hosting a North Carolina Action Hour, which is an educational information session. We're going to have a guest speaker. Senator Adcock will be talking about what to expect during the short session. And it's I'll share the link. You have to pre-register, but it's a Zoom on the 15th. From 12 to 1. It's just a Zoom educational session. Any Hearts for Home Care advocates are welcome. Anyone supporting home and community-based services.
You're doing it on income tax day. 15. Way to remember it. Anybody else got anything?
I just wanted to, in the chat, Tara had to leave, but she did put that the Disability Rights Conference is going to be held on May the 6th. So you could go to the Disability Rights nc.org org to learn more about that event, but that is going to be on May the 6th.
Did she say where it's going to be, Sandra?
No.
It's the Friday Center. They do a great job.
Okay.
Yeah. They have a lot
I think it's on their calendar of events as well.
Okay, good. All right. Well, everybody gear up for Older Americans Month. And we will see you guys next time. Have a good whirlwind of weather changes here. Take care.
Thank you, everybody.
Bye-bye.